Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Let's discuss some benign findings in PNS areas. Here we have axial CT image through PNS area. This is area of the nasopharynx. Here we can see medial and lateral pterygoid plates, medial and lateral pterygoid plates, maxillary sinus on left side, and this is the right maxillary sinus. And this is the fossa of Rosenmuller. In this elevation is torus tubaris, and this is the area of opening of Eustachian tube. Here we see pterygoid muscles and parapharyngeal space. This is deep portion of the parotid gland, and this is the superficial portion of the parotid gland. Here we see retromandibular vein. This one is masseter muscle, ramus of the mandible. Here we see this is right-sided DNS, inferior nasal turbinate, and this is a polypoidal soft tissue arising from the inferior nasal turbinate, extending posteriorly into nasopharynx. So this is a nasal polyp. Here we see diffuse lobulated mucosal thickening in the right maxillary sinus. Here we see MPR images. This is right-sided DNS and inferior nasal turbinate, polyp in the right nasal cavity extending into the right nasopharynx, polypoidal soft tissue in right maxillary sinus, suggesting mucosal thickening, having differential with retention cyst, and polyps in right maxillary sinus. On sagittal reformatting, we can see the exact extent of the polyp into the nasopharyngeal region. Here we see this is sphenoid sinus, clivus, pituitary fossa, cribriform plate, and ethmoid air cells, frontal sinus, nasal bone. This is a coronal reformatting where we can see this is sphenoid sinus, pterygoid plates, and the posterior portion of the nasal cavity at its junction with the nasopharynx, and this one is the soft palate area of the tongue. Here we see nasal polyp extending into posterior portion of the nasopharynx. All these are the same images which we have already discussed. So these are benign nasal polyps and retention cysts and polyps in the right maxillary sinus as well. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.